President Trump recently made a stunning announcement. He said the FDA will warn doctors. The warning, acetaminophen during pregnancy may be associated with a very increased risk of autism. He then delivered a direct message to the public. Don't take Tylenol, don't take it, he said. The declaration sent shockwaves across the country, expectant parents, families' healthcare providers. The news spread rapidly on social media and across news outlets. People had urgent questions about a medication long in household medicine cabinets. This is a developing story. New information is unfolding, science is methodical and takes time. Rely on trusted, verified sources for accurate information. Autism spectrum disorder, or ASD, is a complex developmental condition. It involves persistent challenges in social interaction, speech and nonverbal communication, restricted or repetitive behaviors. The ways in which ASD affects people vary widely. The number of children diagnosed with ASD has seen a dramatic increase over the past 2 decades. The search for the causes of autism is one of the most active areas of medical research today. The scientific consensus is that there is no single cause. A significant body of research points to a strong genetic component. Studies show that ASD often runs in families. Environmental factors are also believed to play a crucial role. It explains why scientists are cautious about claims that a single factor, like a common medication, is the primary driver. The scientific process is designed to isolate and test individual variables. It is a slow, deliberate process that resists simple answers to complex questions. The administration's announcement was more than just a warning. It was presented as a significant policy action aimed at tackling a national health issue. Health and Human Services Secretary Robert F. Kennedy Jr., long associated with challenging established scientific views, had previously set a high bar. He promised a massive research effort that would identify the cause of the autism epidemic by September, allowing for the elimination of those exposures. This political context is impossible to ignore. The announcement was framed as the fulfillment of a promise to find answers for families affected by autism. The announcement also intersects with a complex legal history. In 2023, many federal lawsuits alleging a link between Tylenol and autism were dismissed. But the legal battles did not end. New cases were filed into 2025. The news had an immediate financial impact. After reports the department would release a report linking Tylenol to autism, Kenvue's stock dropped significantly. The reaction from the medical and scientific communities was swift, unified and overwhelmingly critical. Leading medical organizations, which represent tens of thousands of doctors and scientists, immediately pushed back. Dr. Stephen J. Fleischman, president of the American College of Obstetricians and Gynecologists, issued a powerful statement. It is highly unsettling that our federal health agencies are willing to make an announcement that will affect millions without reliable data. ACOG has long recommended acetaminophen as the safest first-line treatment for pain and fever during pregnancy. The Autism Science Foundation labeled the announcement dangerous. Tylenol's manufacturer Kenvue also disputed the administration's claims directly. We believe independent sound science clearly shows that taking acetaminophen does not cause autism. The core of the medical community's opposition centered on evidence-based medicine. Public health recommendations must be built on strong, consistent, and high-quality scientific data. In their view, the administration's announcement did not meet this standard. It appeared to elevate weak or inconclusive findings, while ignoring a larger body of more robust research that showed no causal link. When scientists want to determine if something truly causes a health outcome, they look for the strongest possible evidence. The bulk of scientific literature on acetaminophen and autism suggests no causal link. For decades, acetaminophen has been widely considered the safest available option for treating pain and fever during pregnancy. While some headlines may trumpet a potential connection, the highest quality research has consistently failed to establish a cause and effect relationship. One of the most powerful tools researchers use is the sibling comparison study. This study controls for many confounding variables. It compares siblings who share the same mother. They share about 50% of their genes. They share a similar prenatal environment. They share a similar early life environment. The key difference is the exposure being studied. A major, robust study published in JAMA analyzed a large population. Researchers specifically compared siblings within the same families. Their conclusion: no link between acetaminophen use during pregnancy and autism, ADHD, or intellectual disability. One of the most challenging concepts is the difference between association and causation. Ice cream sales and drowning incidents both rise in summer, but one does not cause the other. The real cause is the summer heat. When evaluating the acetaminophen-autism link, it is essential to consider confounding factors. The most obvious confounding factor is the reason a pregnant person took acetaminophen in the first place. People take acetaminophen to treat fever, pain, or inflammation from underlying illness or infection. A growing body of evidence suggests that maternal infections and inflammation during pregnancy can themselves affect fetal brain development and increase the risk for neurodevelopmental disorders. Therefore, it is entirely possible that the underlying illness, not the medication, is the real risk factor. It is scientifically difficult to disentangle the effect of the medication from the severe viral infection and high fever. Weaker observational studies often struggle to account for this complexity. This is why scientists place more trust in studies designed to minimize confounding factors. When stronger studies show the association disappears, it provides powerful evidence the medication is not the culprit. The narrative that Tylenol causes autism is simple, but the scientific reality is far more nuanced. While the debate over acetaminophen swirls, medical experts point to a different, well-established danger. A high fever, especially during the first trimester, is not benign. The Society for Maternal Fetal Medicine has been vocal about documented outcomes specialists work to prevent. Early elevated core temperature linked to miscarriage, linked to higher incidence of birth defects, neural tube defects, heart defects. High persistent fever can trigger premature labor and preterm birth. Fever in pregnancy must be taken seriously and managed. That's why acetaminophen is widely recommended in pregnancy guidelines with a much better established safety profile. Other OTC relievers like NSAIDs are generally advised against, especially in the third trimester. Often the choice is acetaminophen versus leaving a dangerous condition untreated. The fear, headlines will scare people away from the safest fever reducer. A pregnant person might endure high fever rather than take Tylenol. That can expose the fetus to hyperthermia harms. Medical groups urge patients to talk to their doctors who can weigh known risks of untreated fever against unproven autism risk. The administration also announced an FDA label update for a drug called leucovorin. The agency established a new use for leucovorin in treating cerebral folate deficiency associated with autistic symptoms. This establishes the first FDA-recognized therapeutic for a subset of children under the autism umbrella. It is important to understand the limitations. Leucovorin is not a cure for autism. Its benefits are tied to a specific biological mechanism involving folate transport to the brain. Only a small percentage of children with ASD are thought to have this particular deficiency. For those children, studies suggest treatment may lead to improvements, particularly in speech and communication deficits. The second major announcement was a significant new investment in research. The National Institutes of Health will dedicate $50 million to fund 13 new research projects. This Autism Data Science Initiative is focused on identifying root causes and potential treatments. This injection of funding is a welcome development for tackling a condition as complex as ASD. The projects will likely explore a wide range of genetic and environmental factors, using advanced data science techniques to analyze vast datasets and uncover new patterns. So what are the key takeaways from this confusing and fast-moving story? First, the current scientific consensus does not support a causal link between acetaminophen during pregnancy and autism. While the administration issued a strong warning, that position is not shared by major medical organizations. The most rigorous studies, including sibling comparison studies, have failed to prove the medication is the cause. This is the most important fact to hold on to amidst the alarming headlines. Second, consult your healthcare provider before making any changes. Do not stop or start medications based on a news report. The risks of untreated fever and infection during pregnancy are well documented and serious. Your obstetrician, your doctor, your midwife, they can help you weigh evidence-based risks and benefits, including appropriate acetaminophen use. Open communication with your healthcare team is your strongest tool. Third, follow the science as it develops. New NIH funding for autism research is a positive step. Over time, studies will produce new data and clearer understanding. Seek new information from trusted sources, peer-reviewed scientific journals. ACOG, American Academy of Pediatrics, reputable science journalists who explain methods and limitations. Be wary of sources that offer simple answers or rely on weak preliminary evidence. This is a reminder to be critical consumers of information about our health. The intersection of politics and science can be confusing. Take a breath. Stay calm. rely on existing scientific consensus, and maintain a strong relationship with your doctor. The science will continue to evolve. Stay informed through reliable channels so decisions are based on facts, not fear. Stay informed. Have a great day. Share and subscribe.